What if I told you that a very popular exercise, one you might be doing right now, could be putting your heart at risk? As a cardiac surgeon for over 25 years, I've seen the consequences of good intentions gone wrong. I've cared for patients whose hearts were strained not by a lack of effort, but by the wrong kind of effort, exercises they were told were healthy. In this video, I'm going to show you which exercises could be doing more harm than good after 60 and reveal the simple activity you should be doing instead. First, you have to understand one thing. A heart over 60 isn't the same engine it was at 30. Think of it like a classic car. It's powerful and reliable, but it doesn't handle the same kind of redline stress. The heart's electrical system can get a little more prone to rhythm issues, and the plumbing, your blood vessels, loses some flexibility. Pushing it to the absolute limit, day after day, isn't a sign of strength, it's a gamble. My goal isn't to scare you into sitting still. It's to empower you to move intelligently, so you can stay active and strong for decades. Let's start with a type of exercise I treat with extreme caution for my older patients. The all-out, trap, high-intensity interval training, HIIT, ***. The first pattern to be wary of is high-intensity interval training, or HIIT. The promise is tempting, short bursts of all-out effort for quick results. But for some aging hearts, this shock and recover pattern can be jarring. When you push your body to its absolute maximum, your heart has to suddenly ramp up, then just as quickly, slam on the brakes. For a heart that's lost some of its youthful elasticity, these rapid-fire demands can be too much. There is a concern among some cardiologists that extreme, repetitive stress might contribute to rhythm disturbances like atrial fibrillation, especially if you have an underlying, maybe even undiagnosed, heart condition. Now, let me be clear. This doesn't mean HIIT is off limits for everyone over 60. Research shows that when it is properly structured and medically cleared, it can be safe and very effective for older adults. But for many, jumping into an intense class without a proper green light from a doctor is a risk that outweighs the reward. I'm reminded of a 68-year-old patient who joined a senior's HIIT class, felt dizzy, and ended up in my clinic with an arrhythmia. Her story is a cautionary tale. So what should you do instead? The key is to embrace steady-state exercise. Instead of shocking the heart, you want to train it with consistent, manageable effort. And the best example of this leads me to the ultimate solution I'll share in a few minutes. The pressure cooker, improper heavy weightlifting ***. Next, let's talk about strength. We all know that staying strong as you age is vital. But the way many seniors approach weightlifting can be really risky. I'm not talking about carrying groceries. I'm talking about improper, super heavy lifting in the gym. Here's the danger. When you strain to lift a weight that's too heavy, you instinctively hold your breath. It's called the Valsalva maneuver, and it causes the pressure inside your chest to skyrocket. This pressure can cause your blood pressure to spike temporarily. For a younger person, it's a fleeting event. But for an older adult whose blood vessels might be stiffer, that sudden pressure surge is like a water hammer in an old pipe. It puts an immediate, intense strain on your cardiovascular system. Now, don't get me wrong. I am not telling you to avoid strength training. In fact, major health organizations strongly recommend it. Research shows regular resistance training is fantastic for your heart and dramatically reduces cardiovascular disease risk. The danger lies in improper technique and lifting weights that are too heavy for your current fitness level. The smarter alternative is focusing on light to moderate resistance training, where you can perform 8 to 12 repetitions without excessive strain. You can get incredible benefits from resistance bands, light dumbbells, or your own body weight. The key is to always breathe continuously through the movement. Never hold your breath. The healthy hazard, the burpee ***. So what's the exercise that I believe has one of the worst risk-to-reward ratios for anyone over 60? The burpee. It's often promoted as the ultimate full-body move, but from a cardiac surgeon's view, it can be a real problem for an unprepared, aging body. A burpee asks you to go from standing to a squat, a plank, a push-up, back to a squat, and then an explosive jump. This rapid sequence of lowering your body to the ground and then exploding upward can cause swift changes in blood pressure. For someone with stiffer arteries or hidden plaque, that kind of jarring force isn't ideal. It's a high-impact, high-intensity movement that fitness experts now caution older adults against because of the high risk of injury to the back, shoulders, and wrists. on top of the cardiac strain. Simply put, for many people over 60, the potential for harm with burpees is just too high for the fitness benefits you get in return. So, we've talked about what to be careful with. Now, for the most important part, what should you be doing instead? It doesn't require a fancy gym membership. It is, quite simply, brisk walking. I know, it sounds almost too simple, but don't underestimate its power. The American Heart Association notes that just 150 minutes of moderate exercise per week, like brisk walking, can make a huge difference. Why is it so effective? First, it's low impact. It strengthens your heart muscle steadily and gently, without the jarring shock of high-impact exercises. Second, it improves circulation and helps keep your blood vessels flexible, which supports healthier blood pressure. Consistent walking is directly linked to a lower risk of heart disease, stroke, and diabetes. Third, it helps your whole body and mind. Walking helps manage weight, strengthen bones, improve sleep, and even boosts brain health. Getting started is easy. Begin with 10 to 15-minute walks and gradually increase your time. You want a pace where you can still hold a conversation, but you feel your heart rate go up. That's the moderate intensity sweet spot. Of course, walking isn't the only great option. A complete fitness plan is best. The AHA also recommends muscle strengthening activities at least twice a week. So, combining your walk with the safe resistance training we talked about is a fantastic goal. Other wonderful, low-impact exercises include swimming, water aerobics, stationary cycling, and Tai Chi. The message today isn't about fear, it's about wisdom. It's not about stopping exercise, it's about exercising smarter. We've talked about the potential risks of all-out HIIT for the unprepared, the dangers of improper heavy lifting, and the unnecessary strain of explosive moves like burpees. Your heart has carried you this far. Now is the time to honor it. The goal isn't to push it to its breaking point, but to nurture it with consistent, moderate, and joyful movement. By swapping high-risk exercises for profoundly beneficial activities like brisk walking and smart strength training, you are taking direct control of your health. You are choosing a future filled with strength, vitality, and longevity. Always start slow, listen to your body, and check with your doctor before starting a new exercise program. You have the power to protect this incredible organ. Go take that first step today. Thank you for watching. And I'll see you in the next video.